So today we are going to learn about various instruments. But before we learn about instruments, we need to know about surgeries or operations. So how long do you think surgeries are being done? I'm sure you don't know the answer, so take a guess. How long do you think we have been doing surgeries?
20 years.
20 years.
Or 45 years.
Not 45 years. People have been doing for much longer. I guess. Surgeries, as we know, it has been done for more than 300 years now. Almost 300 years. Okay. And I asked a question, have you seen a surgery called amputation? What is amputation? Cutting off the... Okay. So, below knee amputation is cut off the leg below the knee. Above knee is cut off the leg above knee. Who do you think, I mean, obviously you have not seen, she said there are not any amputations here. But how long do you think should take an amputation surgery? How long do you think it will take? You've seen surgeries, no? So how long will they take to do an amputation?
3 to 4 hours, sir.
3 to 4 hours. We are very slow surgeons. Fast surgeons, how long do you think? 1 hour. But you know the fastest amputation they have ever done? Somebody did it in 29 seconds. Not even a minute.
Bone must have been broken.
No, bones are not broken. They done for gangrene. So why did they have to do it so fast? I'm talking about 200 years ago. Why do you think they did so fast? She said 3-4 hours, then 1 hour, half an hour. Okay. Those days they didn't have anesthesia. So if they don't have anesthesia, what do they do? There are people, 5-6 people will have to hold the patient down and they have to cut as quickly as possible and suture as quickly as possible. That's it. The record was 29 seconds. Less than a minute they can finish cutting off the leg and suturing also. But what is the problem with doing it so fast? You know, during one of the operations, 3 people died. Because the surgeon cut off the hands of the assistants who were holding the leg. They had to do so much. And one spectator who was watching the surgery, he kind of died. The patient died, the assistant died. So the mortality of 300% for one surgery. But nowadays, is it like that? So what made the difference? The earlier, if you had surgery, many of them were dying because of infection, because of bleeding, and the surgery, because of no anesthesia, they had to do it very fast. So now, what all do you do in theatre? How do they do surgery?
We give GA.
Okay, you do GA or you can do spinal or any anesthesia. Then what else do you do?
Or anesthesia.
Okay, anesthesia is okay. So after anesthesia, surgeons become very slow. They have to very carefully they are able to operate. What is the other problem? Even after anesthesia, what else is there in the you have to look after in the surgery for theatre?
Patient's vitals.
No, that anesthetist will take care. See, there is one doctor called Simon Willis in Europe. So he found that almost 50% or half the surgery patients are dying after surgery because of infection. So then all he did was he made them wash hands in between surgeries. And then it reduced it to only 10% or 5% dying. So what is the next important thing you have to do? So the antisepsis or it has to be sterile, healed or clean surgery. Okay, so these are all big advancements which happened in surgery. One we had anesthesia, one we had sepsis. So what all do you do to make sure there is no infection? How do you maintain sterility? Okay, so you wear gloves which are sterile, you wear gown which is sterile, then you clean the place that you are operating with the antiseptic medicines, then you have sterile sheets and covers and so on. And then most of the surgeries are done by open method. Who saw appendectomy? Did anybody see the, none of the students saw?
Students, they did not get those.
Okay, so how did they do appendectomy here?
Pinhole, sir.
Okay, so what is a pinhole? Do you have a pin?
Laparoscopy.
So they make small holes with a pin, then? What is he saying? He's saying the pinhole surgery, no? What is that? Hmm? Sister is saying laparoscopy, she is saying pinhole. And do you have any other name for it? You have the keyhole surgery. So what is the difference between open surgery and the pinhole surgery or keyhole surgery or laparoscopy surgery? Hmm? What is the difference? So like she said today she saw surgery for removing the appendix. Okay, so what is the surgery name called? Appendicectomy or removal of the appendix. Okay, so what is the difference between removing laparoscopically or through pinhole or keyhole or removing with open? Is the surgery different? Yes or no? No. Then what is the difference? Did they cut anything during pinhole surgery?
Yes, sir.
Yeah, so they did cutting. So what is the difference? What is the difference between pinhole surgery and open surgery?
Open surgery, we have to cut it. And pinhole is like instrument through scope.
Okay, so why through scope? I can't even straight and take it. Okay, surgery is the same. The objective of the surgery is the appendix disease. You remove the appendix. And you cut the appendix, which is which has pus, which is gangrenous, you remove it. Okay. Open surgery, you cut the abdomen open, see the appendix, and then remove it. So, laparoscopic surgery, how do you see the appendix? Open surgery, you see with your own eye, you have a light there, you spray, you have a retractor, then you see. So, how do you see in abdomen?
Camera. Through camera.
Hmm?
Monitor. Camera.
So, camera, where was the camera? Inside the body or outside the body?
Instrument.
Huh?
The scope.
Okay, so what is that scope called? Okay, can you click on the scope if you can see the scope there? So what is this?
Scope.
What scope is that? Hmm? It's a scope. It's a telescope. Okay. And what is it used for? Laparoscopic surgery. Okay, so it's called a laparoscopic telescope. Okay, so what do you think is the diameter of the scope in millimeters?
1
1 centimeter, how many millimeters? Okay, this is 10 millimeters. Okay, 1 centimeter, 10 millimeter scope. So this is called the 10 millimeter scope. Okay. And why is the tip not straight? It's like this in an angle. So some scopes are straight like this, some are angle like this. If it is straight, you will see straight what is ahead. So that is called 0 degree scope. This is angle 30 degrees. So this is called 30 degree scope so that you look down. So what scope is this? Okay, so this is called 30 degrees, 10 mm. What scope?
Telescope.
Laparoscope, telescope. Okay. So what is the function of this 30 degree 10 mm laparoscopic telescope? So what all does it do? So if you see, then that's what happens. Can you see through this?
Oh, yes, I can see.
Okay. So you want to see? You want to see. What do you see?
Very far.
Okay. So it transmits pictures from below to the eyepiece. Okay. So what else will you do? If you put it inside the abdomen, can you see the appendix? Yes?
Yes.
Sure. Hmm? What light do you have inside the abdomen? Do you have a bulb inside the abdomen? Or do you have any light inside the abdomen?
No.
Then how will you see? Okay, now, see, now see, can you see? Now can you see?
No.
No?
Yes.
Okay, you see only when there is a light. So how does the light go into the abdomen? On the monitor. So monitor, usually what we do is we connect the camera here and then it goes to the monitor so that instead of directly seeing inside, you see in the TV. What about light? How does the light go into the monitor? You see the pictures. Monitor is connected to the camera and you see the picture. So you have a light source. Okay, it is connected here and then it transmits the light. Okay, so the function of this is to transmit light from outside to into the inside abdomen. And also pictures from here, you can see it through the camera and goes to the monitor. Is that enough to do the surgery? Can you do laparoscopic surgery just with the telescope?
No.
Okay, then what else do you need? I think unfortunately only both of you have seen surgery, so you have to do that. So how did they remove the, you saw the appendix, no?
Yes.
So what did they do to the appendix?
Caesar also makes that.
Okay, sisters. Okay, so can you open that? Why did you all do one thing? Why did you all stand and come? Stand and... Okay. Okay, so does it cut? Okay, the scissors. But can you just cut the scissors, the appendix and take it out? Huh? So what? How do they do appendicectomy? It's all up and down. So you can 2 fingers and go up and down. Go through all instruments. And then we'll ask you questions about, ask you to pick up each instrument from there. Okay. You can either watch there or watch there. And the names are written here. Okay. So you go through that and not urology suitcase, it doesn't look like a suitcase. So what is it called? Loud, I can't hear it. What is the name of this? Ureterorhinoscope. Okay, one is 9 French, one is 7.5 French. Okay. So what about the next one? Can you bring? Come. Okay, what is this called?
Laparoscopic tooth grasper.
I don't see any teeth. Okay, so this is it. Come, show your hand. Is it causing a lot of trauma? Okay, so then if it doesn't cause trauma, what is it called? Atraumatic. Okay, so this is also called laparoscopic grasper. And what is this? This is called the ratchet. So this you don't have to keep on holding it. If you hold the structure, you can lock it here. Okay. And it has you operate by moving this, so that the jaws open and close, and this you can rotate the entire instrument. Okay. Right. Next one. What is this called?
Laparoscopic atraumatic grasper.
Okay, so the same thing you. So this also has a ratchet for holding it. Now open and close. No, this is that was opening when closing. Now why is it not opening now? Earlier it didn't open, now it's opening. Why? So normally you have to, whenever you have an instrument, you have to make sure it fits correctly and it's tight. Only then it will open nicely, and this is for rotating it. Okay. Okay. Next instrument. Oh, so what is this?
SPC trocar and cannula.
What is SPC? Suprapubic puncture. So what is? Why is it half like this? Okay, so what we use it is, if the bladder is they are not able to pass urine from below, we want to put a catheter, you fill the bladder, poke it in, then you take it out. Then you pass the catheter through it. So once it's inside the bladder, you can pull the catheter out like this. So that's why this thing is called SPC, trocar and cannula. Okay, what is this?
Trocar plug.
Okay, this is the 10 mm trocar. So what is this for? Connecting the gas. And what is this? This is a valve to prevent the gas from leaking. And this is called the reducer. So if you want to pass in large instrument, small, the 10 mm trocar, gas will leak all around it. So to prevent the leak, you put the reducer here like this, and then pass the instrument. Okay. Okay, next one. What is this?
Laparoscopy suction.
Okay, only the suction. Okay, this also doesn't work properly. Okay. Okay, so this, what does this do?
For suction that you.
Yeah. See, you can either connect the suction to this side or this side. Or what you do is you connect the suction through one end and you connect the IV fluid or something like that for irrigation. So you can push in the fluid inside the abdomen and suck it out. It's called a suction irrigation. Okay, good. Next. So what is this one?
5 mm trocar.
So what is 5 mm here? Okay, it's the diameter here. So what do you use 5 mm trocar for? To pass all the smaller instruments, the 5 mm instruments during laparoscopic surgery. Good. Next one. Okay, what is this?
Cystosome by Gustave.
Hmm? What is this?
Cystoscope.
This is not the cystoscope we grasper. So it's a grasper. But does it go through the cystoscope or it goes through the URS? See, it's long, so it goes through the URS. So it's a URS grasper. Okay. Next one. So what is this?
Working element telescope.
Okay, so it has a working element, and this is of course the urology telescope. So this is a 4 mm telescope we use for urology. And what do you use the working element for? Okay, you use the working element for either if you have to cut a stricture or if you are removing the prostate or something, then you use the working element. Okay, this is interesting. So what is this?
Erino HST cannula.
Hmm?
Erino HST cannula.
Show me there. Yes, what is it written there? I thought it was written Rubens cannula. Show the picture there. This is for injecting dye into the uterus. So, if the cervix, you push it in here, tight it, then inject dye into the cervix. That is it. What is it written there?
Rubens cannula.
Yeah, Rubens cannula. Okay, good. See, laparoscopic surgery or pinhole surgery, we said you have to use gas to create space for operating. So this is what we use. This is for gasless laparoscopic surgery. We pass this in the umbilicus and lift the umbilical wall, so that we can pass the instrument, create the space for operating. So the advantage of this is we can do it under spinal anesthesia, so that you don't need gas and all the big equipment for creating the pneumoperitoneum to operate. And also we can do with a single incision. See, if you are doing gas laparoscopy surgery, we need multiple ports, one 10 mm, at least 2 5 mm ports. This with just a single incision in the umbilicus, you can start doing the operations. And you don't need expensive equipment like this, because it's a gasless system. So there is no leak of gas. So that way it is much easier to do. This is called the retractor, what we use for gills or gas insufflation-less laparoscopy surgeries. Okay. Okay, any questions or shall we finish? Okay, so tomorrow, next time we will ask you questions on what we learnt.